Today's video, we are going to be talking about symptoms of infertility. When these things are happening to you, it means that it's telling you that you are infertile. Being infertile doesn't mean that you cannot be fertile again. It means that within this time, something is blocking you from becoming pregnant, and when those things are being fixed or treated, then you can become pregnant. So infertility is not something that I don't know how to explain it. Now, number one is your inability to get pregnant. If you are a woman that have been trying to conceive, depending on your age, over 1 year, you have been making out with your spouse without using any protection, and yet you are not able to become pregnant, your body is telling you that something is hindering you or your partner to become pregnant. Now, if you are under 20s, you should try on your own for a year. If nothing happens, then you go and seek for fertility support. If you are under 30, you should try at least 6 months. Then after 6 months, if nothing happens, then go and seek for support. If you are 40, you do not try anything. Rather, you stand up immediately to seek for support. So your inability of getting pregnant for a long period of time shows that you are infertile for that time being. I don't want anybody to misunderstand me. So the number two that tells you that you are infertile is a menstrual cycle that is longer than 35 or more days. Normal cycle length starts from 21 till 35. If your cycle exceeds 35 days, there is a problem and you need to seek for support. If your flow exceeds 35, I know why I'm paying much emphasis on this, you need to seek for help. There could be other developing issues which I cannot say. It is only your gynecologist or your fertility doctor or your healthcare provider that have right to conduct tests on you and find out the causes of this. Now, with this, I welcome you all anywhere you are watching this video. If you watch up to this moment, I pray that God Almighty will bless you. You know what you would do? For you to watch up to here means that you like this program, right? Share. If you haven't followed us and you like our content, follow us. I want to put a disclaimer before I continue that myself, Tochi, I am not a medical practitioner, I'm a researcher. Whatever I'm giving you here is general information that you can find everywhere. If you need help, support, prescription, recommendation, kindly contact your healthcare provider or your gynecologist, that is female doctors or fertility doctors. These people will go extra mile, conducting tests on you, taking your history, and after that, they will now profile a solution. Therefore, Tochi do not have right for any prescription. I do not prescribe. Rather, I teach, inform, educate, enlighten, sanitize women, which majority women have benefited from my teaching. Take note of that. So, I said the number one sign that makes you to understand that you are infertile for that time is your inability to become pregnant. The number two, I said, a menstrual cycle longer than 35 days. I said normal cycle starts from 21 till 35. If your cycle exceeds, like some people always ask me, somebody said, my cycle is, 40 days. When do I release egg? There is nothing like 40 days cycle. Have 21 days. I'm speaking German. 21 till 35. So if it exists 35, then you should contact a gynecology. Now, if your cycle is less than 21, it is also not normal. Another sign that tells you that you are infertile is your irregular or absence period. Whenever your flow is not coming, I'm going to explain this broad so that people will understand. Now, if you are around 48, 49, if your flow used to last like 4 days, it will be reducing because you are approaching your menopause. For people who have entered premenopausal or menopause, you don't expect your flow to come and you don't expect yourself to get pregnant naturally. But the other way around, you can become pregnant through the help of assistant fertility support like IVF. If you have entered menopause or if you are premenopause, some people enter menopause before the actual years of menopause, which researchers made us to believe that this starts at the age of 50 to 55. So if you have entered menopause, it means that your estrogen have stopped. You cannot produce estrogen, which means you cannot produce egg. So you cannot become pregnant in a natural way, but through the help of fertility doctors, you can. Now, if you haven't entered menopause, you are between 48, 49, you will see that your flow will reduce. Maybe you used to have it 5 days, 4 days. It will be reducing in length and also in the volume. The way it used to flow before, it is not the same way it will flow again. Now, if you see your flow for only 1 day, it is not good. I mean, people have not entered menopause. I don't know if I'm communicating. Please let me know if I am not communicating. I try much as I can not to use big grammar so that my purpose is that any layman in the village, when they are watching me, they will understand, because I am not here to educate those that are already educated. Rather, that poor man, that poor woman on the street that do not know where to start from, that do not know what to do. These are the people that I am creating my content. You don't expect me to speak grammar. If you are speaking and people do not understand, communication have not taken place. Effective communication takes place when the listener, let me use it in journals, when the decoder and encoder understand themselves. That is only when you will say that communication have effectively taken place. So don't expect me to use medical terminologies or that. I don't use them. If I try to use anyone, I will explain it. Besides, I am not a medical practitioner. So when your flow is irregular, for example, people with PCOS, they do not see their flow every month. Sometimes once in 3 or 6 months, sometimes 2, with the help of some medication from their doctors. So some do not even see it. And what baffles me is this: people will relax. You don't see your flow. You have not entered menopause. You want to become pregnant. You just relax. You are not doing anything about it. You are not worried. Come on. Whatever that goes on in our system gives us sign, but because we are so busy, we pay less attention to our system. Instead, we concentrate on others. You haven't solved your problem. You are looking at another person's problem. No wonder the Bible always tells us to remove the heavy plank in our eyes before removing others. So if your flow is irregular, I have explained what irregular is. Irregular is you not seeing your flow every month. Now, variation of cycle simple means that your cycle changes dates. For example, you see it on 20 this month, 21 this month. Next month it will be 22 or 23. This is variation. This is not irregular. Irregular is when you do not see your flow every month. So these are the signs that would tell you you are infertile. Please, as you are working on yourself, also include your partner. Do not leave him behind, because if he have problem, it is also going to affect you. Work together. As you are going for full fertility checkup, let your partner also go for sperm analysis. They will check his motility the count and the morphology. So when everything is okay, then you guys are good to go. Did you learn anything from this video? Did you? If you do, follow us, share our videos. God will bless you. Like I said from the beginning, I am not a medical practitioner. I am a researcher. I only teach here. I do not prescribe. Thank you so much.